Hello everyone, this is Shubham and today I will talk about the antihistamines. However, there are H1, H2, H3 and H4 receptors in our body, but for the therapeutical uses, we have the H1 and H2 blockers. And in this lecture, specifically, I will talk about the H1 blockers because H2 blockers, we will talk about them in the GIT pharmacology. So let's talk about the H1 blockers. So in this video, throughout this video, I will discuss about the first of all what is the histamine, what is the location, how histamine is synthesized in our body, how they are released or what triggers the release of the histamine, what will be the actions of the histamine in our body, and later on I will talk about the actual antihistamines, more specifically about the H1 blockers. What will be the therapeutic uses, what will be the adverse effects of antihistamines. So let's talk about the histamine. Histamine are the chemical messengers. Mostly they are present in the mast cells and basophils. Now, more practically, they are present in all our tissues. But more specifically in significant amount, they are present in our skin, blood vessels, our lungs and GIT, gastrointestinal tract. And also they are found in the components of some venoms, dyes, and some insect stings. For example, ant sting, honeybee sting, or scorpion or spider sting. Now, this was about the location, about the synthesis. Actually, let me talk about the location over here. Let me write very briefly about the location. They present in skin, blood vessels, lungs and GIT. More significantly, they are present in these tissues. Now let's talk about the synthesis, which is really important to know that how histamine is synthesized in our body. Actually, histamine is produced by the decarboxylation of amino acid histidine. So here is histidine, which is an amino acid. Histidine is synthesized into the histamine by the decarboxylation, removal of the carbon dioxide. And this process occurs with the help of an enzyme. What is the name of that enzyme? Is histidine decarboxylase. Histidine decarboxylase. So this is the enzyme which helps the synthesis of histamine from the amino acid histidine. Now, actually the histamines are stored in granules in the mast cells. As I already mentioned, they are mainly found in mast cells and basophils too. So they are present in the granules over there. And if the histamine is not present in those granules, they are destroyed by an enzyme, amine oxidase. So they are present mainly, for example, this is the mast cell here. These are the histamines. They are present in the granules over there. And the histamine which will be present outside this, which will not be present in the granules, they will be destroyed by an enzyme which is amine oxidase. Amine oxidase. Okay. So this was about the synthesis of the histamine. Now let's talk about the actions of the histamine. So we're discussing about the actions. I forgot to tell you about the release, that how and what triggers the histamine release. Actually, there are the basic three things which you can say those triggers the release of the histamine into our body. So what are those? What triggers histamine release? First of all, the allergic reactions. Allergic reactions. Second, any kind of tissue injury or trauma. Any kind of tissue injury or trauma. And the third one is drugs or venoms. So what will be the process, what will be the mechanism of the release of the histamine if we talk about the allergic reactions? Actually, if any antigen comes into our body, they will activate the T helper cells. As you can remind from the immunology, that they will activate the T helper cells, and thereon they will activate the B cells, and B cells will further activate the plasmacytes or plasma cells, which will produce the immunoglobulins. And in the case of histamine, as I am talking about the histamine, they will produce the immunoglobulins type E, which also induce the hypersensitivity type 1 reactions. So they will produce, plasmacytes will produce their immunoglobulin E, and immunoglobulin will bind to the mast cells over there. And if any allergen will come in contact with the antibody, which is IgE, immunoglobulin E, then what will it do? It will cause the degranulation of the mast cells, and they will release the histamines. And what histamine will do? As I will talk about the actions also, histamine will increase the blood vessel permeability, and they will cause the vasodilation. So that is the mechanism of the allergic reaction, that how allergic reactions, they induce the release of the histamine. Now, if I'm talking about the tissue injury, directly if any kind of trauma or any kind of tissue injury is happening in the body, then they can directly destroy the mast cells, which will cause the degranulation of the mast cells. So they will release furthermore histamine. And histamine, as I told you, that histamine will cause the permeability, increased permeability of the blood vessel, and which can cause vasodilation. Now, drugs, venom, same, that any alkaloid or morphine, for example, or any other drug, any other poison or venom, they can also harm the mast cells and can cause degranulation, and thereon the histamine will be released. So these three are the mechanism, or these three are the reactions that they can induce the release of the histamine into our body. Now let's talk about the actions of the histamine, that what they are doing in our body. So let me talk about the actions of histamine. Right now I'm talking about the H1 receptors, that they are blocking the H1 receptors. So let's talk about the actions of the histamine. Actually, first one, they can bind to the H1 receptors present in the vascular walls of the blood vessels. So they can bind to the H1 receptors of blood vessels. They can bind to the H1 receptors of smooth muscles present in our lungs. As histamine is a chemical messenger, as I already mentioned, so they are also act as neurotransmitter in the CNS. So they can bind over there also, H1 receptors, CNS for example. And fourth one, the H1 receptors of peripheral nerve endings. For example, they are innervating our skin. Peripheral nerve endings. Peripheral nerve endings. So if they will block the H1 receptors of blood vessels, if they will block the H1 receptors of blood vessels, what they will do? They will increase the permeability of blood vessels. They will increase the permeability of blood vessels. Or in other words, you can say they will cause the vasodilation. They will cause the vasodilation. Now, if they will block the receptors, H1 receptors of smooth muscles, what they will do? Simply they will cause the contraction of respiratory airways. Contraction of respiratory airways. Now, if they will block the receptors over there in the CNS, what it will do? It will cause the wakefulness. It will cause the wakefulness, as well as it can increase the appetite suppression. Means this person don't want to eat. Now, if they will block the H1 receptors of peripheral nerve endings, they will cause the itching of the skin. Itching of the skin. So, these are the actions of the antihistamines, actually, that if they will bind to the receptors of the various organs, that what they will do or what reaction they will occur over there. Okay, so this was about the actions of the antihistamines. Now let's move further and let's talk about the real antihistamines. Let's talk about them, antihistamines or H1 blockers. Actually, antihistamines, H1 blockers, they are divided into two groups: first generation and the second generation. So these are the antihistamines, right? So they are divided into first generation drugs and the second generation drugs. Okay. Now, what are the differences between these two generations, the first generation and second generation? Actually, the first generation drugs are the older ones. We don't use nowadays, or we use them, but we don't use them frequently. As if we talk about the second generation, nowadays we are using second generation H1 blockers more frequently, as they are older and they are the newer drugs. They are more lipophilic. The first generation drugs are more lipophilic, means which shows that they can easily pass the placental membranes. For example, they can cross the blood-brain barrier. As they are lipophilic, they can cross they can penetrate the blood-brain barrier. They are not so lipophilic. Second generation drugs, they are not so lipophilic. So they don't pass usually, they do not cross the blood-brain barrier. Now, as they can cross the blood-brain barrier, they can cause some sedative actions, some sedative effect they can show. And second generation drugs, usually they do not show sedative effects as they are second generation, as they are newer drugs, and they do not cross blood-brain barriers. But however, some drugs like cetirizine or levocetirizine, they can show some sedative effects, but usually they do not show sedative effect, no sedative effect, no sedative effect. Now, first generation, they have more side effects, more adverse effects. And they have less side effects or less adverse effects. Now, first generation drugs, as I'm talking about the H1 blockers, but they also blocks other receptors, for example cholinergic receptors, alpha adrenergic receptors, or serotonin receptors. So we have the complaint about the first generation drugs that they can bind to the other receptors and can cause other various kinds of side effects. So first generation drugs, that's why we also don't prefer first generation drugs over the second generation. So they also not H1 selective. They are not H1 selective, but as compared to the first generation, second generation H1 blockers are more selective, more H1 receptor selective. More H1 receptor selective. So this was the basic difference, you can say, between the first generation H1 blockers and the second generation H1 blockers. Now let's talk about the examples of first generation drugs and second generation drugs. That's what the drugs are including in the first generation and what the drugs comes under the second generation H1 blockers. So let's talk about the drugs over here. There are various kinds of drugs in both these categories. But first, let's talk about the first generation. For example, cyclizine, meclizine, promethazine, hydroxyzine, if you see the endings are like zine, cyclizine, meclizine, promethazine, hydroxyzine. So the endings you can learn from here that they ends with the zine suffix. Now, doxylamine, this is somewhat different. Doxylamine, chlorpheniramine, so these are, they have the suffix amine and amine, these ones, chlorpheniramine, doxylamine, and we have chlorpheniramine, doxylamine. So these are the basic ones, and you can add over here cyprohepatidine, So these are some drugs, some basic drugs that those are considered under the first generation drugs. Now these two drugs are also used for the nausea and motion sickness. Nausea and motion sickness. These drugs. And as I said that these drugs do cross the blood-brain barrier, so they got the sedative effect. So these drugs over here, they shows the sedative actions. They show the sedative actions. Now let's move further and let's talk about the second generation drugs. They are cetirizine, they are levocetirizine, loratadine, desloratadine, and fixofenadine, so these are some drugs as far as second generation H1 blockers are considered. Now, as I mentioned earlier while talking about the adverse effects over the first generation drugs, second generation usually they do not cross the blood-brain barrier, but some drugs they can cross the blood-brain barrier and can cause sedative effects. Now cetirizine and levocetirizine, they show some sedative effect. But as far as these three drugs are considered, loratadine, desloratadine and fixofenadine, they do not show sedative effects. So these were the drugs, that what drugs are considered under the first generation and what drugs are considered under the second generation H1 blockers. Now let's talk about the therapeutic uses of H1 blockers, where we can use these drugs. As I talked about some uses earlier also, that they can be used in the allergic reactions or inflammatory reactions. But what are the other uses other than that? Now, let's talk about them. So, therapeutic uses. First of all, they can be used in allergic and inflammatory reactions. Which is very much understandable that they can block the H1 receptors over the blood vessels, and what they will do, they will further not cause the permeability, they will decrease the permeability of the blood vessels, and there will be no vasodilation. And further, they will they will inhibit the degranulation in the mast cells. So there will be no further more release of the histamine over there. So they can reduce the allergic and inflammatory reactions. Second, somnifacients, which means those persons which are suffering from insomnia. However, H1 blockers or more first generation H1 blockers are used in this condition. We don't use second generation H1 blockers. Insomnia. And lastly, motion sickness and nausea. However, we should give these drugs, mostly first generation antihistamines, before the motion sickness, because before the incidence of the motion sickness with the scopolamine, as I have told you about the scopolamine in cholinergic one. So we can give first generation antihistamines along with the scopolamine, but before the motion sickness, because they are more effective before the incidence of motion sickness rather than after the starting of motion sickness. Okay, so this was about the therapeutic uses of the H1 blockers. Now, briefly, let's talk about the adverse effects. Adverse effects. As I mentioned earlier about the first generation antihistamines, that they can also block the along that H1 receptors, they can also block the cholinergic receptors, alpha adrenergic receptors, and also the serotonin receptors. So what will be the effect over there if they will block the cholinergic receptors? So if they will block the cholinergic receptors, there will be the dry mouth, there will be the urinary retention. If we talk about the heart, there will be sinus tachycardia. So these are some side effects that if some H1 blockers, first generation H1 blockers, if they will block the receptors of cholinergic, they will block the cholinergic receptors. So these could be the side effects. If we talk about the alpha adrenergic, there could be the dizziness, hypotension, reflex tachycardia. If we talk about the serotonin, they will block the serotonin receptors. Then they can increase the appetite. And if we talk about the specifically H1 receptors, if they will block the H1 receptors, so of course they will reduce the allergic and inflammatory reactions. They can cause the suppression in the neurotransmission, as histamine is also a chemical messenger. So they act as the neurotransmitter in the CNS. Also they can increase the appetite over there. So these were some effect of the histamine. That, and also H1 histamines, all types of generations, first generation, second generation, they bind to the H1 receptors. However, H1 antihistamines, they can bind to other receptors too. For example, cholinergic, alpha adrenergic, and serotonin too. Now, let's talk about the adverse effect, that overall adverse effects. What will be the overall adverse effect, to learn that if somebody is asking about the side effects of antihistamines. So let's sum up over here. You can learn these side effects from one mnemonic. And what is the mnemonic? You can learn it from the word vidyut, which in Hindi it means electricity. Vidyut. Now, what is V? V is vertigo. What is I? It will increase the appetite. D, it can cause dry mouth if they will block the cholinergic receptors. One more D, which means they can cause the drowsiness. H, as they cause vasodilation, so they can cause hypotension too. U, again, by the blockage of the cholinergic receptors, they can cause the urinary retention too, and also they can cause tachycardia. So you can remember the side effects of adverse effects of the antihistamines by the term vidyut. I hope this will help you in remembering the adverse effects of the antihistamines. So this was all about the antihistamines. I hope you will like this video. Thanks for watching.